Hello, good morning. Welcome. Welcome to this Middle East Institute webinar. My name is Karen Young, and I'm a senior fellow and director of a new program on economics and energy at MEI. We're delighted today to continue the series of webinars in partnership with the Arab Barometer, which is a nonpartisan research network providing insight into the social, political, economic attitudes and values of ordinary citizens across the Arab world. Over the course of 4 successive Tuesdays, MEI and the Arab Barometer will present key findings of the latest barometer polling, Wave 6, which covers the period up until March-April 2021. The first session on June 8th dove into attitudes on international relations, including the US since the inauguration of President Biden, China, and regional powers. Today, we'll be looking at popular attitudes regarding COVID-related challenges, state capacity. On June 22nd, we'll look at polling results regarding domestic conditions, including views on government, economic conditions, and civil rights. And the series will conclude on June 29th with a discussion on gender, including women's rights, roles, and empowerment. We hope you can join us for the rest of these series and the events. To present the findings on government performance today, we're joined by Salma Al-Shami, who's Deputy Regional Director for the Middle East at Mercy Corps and a non-resident scholar at MEI. Yasmina Abu-Zahor is a visiting fellow at the Brookings Doha Center and at the European Council on Foreign Relations. And we have Salma Al-Shami, who is part of the Arab Barometer team. She joined as a senior research associate in September 2019. In collaboration with the director, she's responsible for questionnaire design, data processing, management, statistical analysis, and dissemination of the study findings, which is what she's doing with us today. So before we hear Salma's presentation, we're going to have Shayla provide some commentary on the impact on refugee communities. She has to leave the webinar in 30 minutes, so we're going to let her make her remarks early and then move on to her other work. If you're joining us through Zoom, you can make questions or comments through the Q&A function. If you're joining us on live stream, please email your questions to events@mei.edu. So with that, please let me turn the floor over to Shayla and hear her remarks, and then we'll move to the Arab Barometer official findings. Thank you so much.
Thank you, Karen, and appreciate the Middle East Institute always convening us towards important and critical topics in the Arab world and the Middle East. And thank you for putting me, providing me the space to talk a little bit at the very beginning, as I'm obliged to leave in half an hour. In general, I think it's the COVID pandemic actually added to what's already chronic problems, chronic structural problems in the Middle East states, especially those states who are hosting the IDP communities, and also those states who are kind of where the IDPs are coming from. So both sides are suffering, and the COVID actually just added to these or inflated these chronic problems. So very quick overview, these chronic problems that were exacerbated by COVID are basically the fragility of all these states in general that we are talking about, the lack of institutionalization, which means or reflected in the weak health system, not able to absorb such waves of kind of a very critical and dangerous pandemic that clearly was reflected on the general population, let alone at the IDPs and the refugees and the IDP camps. So that was clearly manifested in those camps. That was number one. The second chronic problem in the Middle East in general is obviously unemployment / the youth bulge. And what does that mean, or how does that reflected in the economic consideration of the impacts of COVID is that most of the young generation resorted to gig informal job opportunities, specifically through some sort of delivery of informal services for the rest of the population segment. So that was, and it was almost day-to-day job opportunities, day-to-day income generation. There was no clarified structural sector for this. It was already a nascent sector that was absorbing a huge number of youth, both women and men. And of course, where this could be more manifested than the IDP camps and the people trying to make a living day to day. When COVID hit all these countries, obviously with the lockdowns and obliged to be in lockdown, these informal job opportunities and services all stopped. Or sometimes people, especially the IDPs and refugees, were obliged to go forward no matter what, or regardless of the critical health consideration, and then ended up in the hospital, and then end up constraining what already is a very limited health resources available for them. So it was a vicious cycle. The other chronic problem, of course, the lack of inclusivity and diversity in the economic sector in general, including some cross-cutting themes like gender considerations. No other segments among the youth who've been hit hard, and of course with the high unemployment section, the other cultural and traditional considerations, in addition to COVID, actually hit the women employment hard, and hit the IDPs who are trying, obviously. In most of these camps, mainly the household or the head of household is a female who is trying to feed her children and provide protection, at the same time trying to compete with the rest of population about what is already scarce employment opportunities. If we fast forward, these are through 2020 all on to 2021, being exacerbated and actually floated in the system and pressed the general economic sector in those countries, but actually creating financial hardship and economic crisis. If we, as I said, if we fast forward to 2021, which a little bit there is a room to wiggle, given that there is a starting up of the vaccination and all what entails of having the need to have very strong institutions in order to administrate an effective vaccination campaign, in order to administrate a national action plan. In most of those countries, the national action plan, it's not adequate, or even they don't have it, and the institutionalized approach into vaccine rollout is very weak. So this actually extended and prolonged the impact of COVID on economic situation in the Middle East, and that's why we are seeing that maybe major countries or major fragile countries in the Middle East, Syria, Lebanon, Yemen, Iraq, we have extended long-term impact of COVID, despite the numbers we are seeing are positive or going down a little bit, or the number of vaccines are increasing daily, but the long-term impact is prolonged beyond its time frame, or we were hoping for in compared to other countries. I would like to keep it short and hear the presentation and more inputs from the esteemed panelists, and I look forward to this discussion. Thank you very much.
Thank you, Shala. That was excellent. And I think what you really laid out for us was, the problem of institutionalization of public health delivery, but how it hits vulnerable populations the hardest. So whether it's women, head of households, youth, or generally those working in the informal labor markets, and those in fragile countries or countries that are in post-conflict reconstruction, that's the worst case scenario, right? But in broad terms across the region, where the survey results are, Salma can share with us, what citizens' attitudes were. How did they see governments really doing in terms of service delivery and help in the pandemic? So Salma, we turn it over to you. I know you've got some fantastic slides for us, so the floor is yours.
Thanks very much. Let me just share my screen here. All right. Thank you very much for having me. So I'm here to discuss, as Karen mentioned, the latest results from Arab Barometer's findings on citizens' experiences with the challenges of dealing with the pandemic and their assessments of government response. For those of you who are unfamiliar with the Arab Barometer, we're the longest standing and largest repository of publicly available data on citizens' views in the Middle East and North Africa. We've conducted 90,000 interviews across 70 national surveys, 6 waves in 15 countries. In so doing, we're committed to transparency by making all of our questionnaires and data available publicly in both Arabic and English. We're committed to rigor by constantly updating our questionnaires and our sampling procedures and subjecting the data that comes back to rigorous quality control checks. And finally, to developing capacity in the region such that data collection is not just an extractive process, that we're really providing training to our regional partners and that we make sure that we incorporate their invaluable feedback into the surveys we distribute. Our latest wave of surveys, round 6, was completed by phone, which is a slight departure from our previous rounds, which were primarily done face-to-face. Numbers were selected through random digit dialing and a list in the case of Lebanon. Our phone surveys mandated that they be slightly shorter because attention spans are typically different on the phone. And so we had to cover numerous topics. What this means in practice is that we actually had a series of surveys. So our first set of surveys was done in the summer to early fall of 2020. The second set was in October of 2020. And as Karen mentioned, our latest bout of surveys was in March to April of 2021. What this actually allowed us to do was track the changing opinions and experiences of citizens in surveyed countries over time. I'm happy to speak more to our methodology in the question and answer session. To provide a bit of a highlight reel of what I'll be speaking to today and what I'll discuss in more detail. Overall, what we're seeing is that public opinion on government response to the COVID-19 pandemic in these countries is varying according to the assessments of the healthcare system and assessments of inflation control. Unsurprisingly, where citizens rate both of these factors positively or negatively, we're seeing commensurately high or low responses to or evaluations of government response to COVID. But where evaluations are really more mixed, it looks like it's really positive evaluations of the healthcare system that are propping up the overall government response. Additionally, we're seeing that the concern over the spread is not over yet. We're observing some vaccine hesitancy among certain populations, and I'll speak more to that. One of the key issues that publics are pointing towards, in addition to health and the economy, is the education of children and the disruption that the pandemic has caused to that trajectory. And finally, as Shala mentioned at the beginning, the pandemic does stand to deepen economic inequality as kind of job loss and inflation are threatening economic stability. This one story of COVID-19 in MENA is kind of captured by this one graph. And what we're seeing is significant regional variation in government response. And we're also seeing kind of shifts over time in several countries. To be sure, this all needs to be understood against the backdrop of what was happening with the pandemic in the region. So if you see here on the very left, that first line represents October 30th, which was the end of our second set of surveys. At that point, none of the countries had really seen peak number of cases. And in fact, caseloads until then had been relatively low. In fact, governments hailed as having done a relatively good job at keeping the spread at bay. The second line, however, on the right represents April 14th, which was the last day of fielding in our last country of the third set of surveys. Of course, by that time, it's a different story. You've seen multiple peaks throughout. That peak on the right for Jordan is on March 21st, which was actually the first day of our fielding, our third survey there, amidst that really tragic circumstance when the spread had really skyrocketed. Under Jordan, that pink line, the kind of the third peak under for Lebanon, that's actually March 25th when we started our last set of surveys there. And so it's really against this backdrop that what comes clearly through is that the pandemic is far from over in MENA countries, and that's clearly reflected in what people are saying. In surveyed countries here, we see kind of three groups where concern is quite high. And in Libya and Lebanon, it is high and stays high over time. In Jordan, of course, amidst that peak, it is increasing. And then in Morocco, Tunisia, and Algeria, it's decreasing, although it's still majorities or slight majorities in those countries who are concerned about the spread. One of the strongest trends that we've seen throughout, and that I'd like to briefly mention here, is the persistent gender divide, where women are more concerned or disproportionately affected by the pandemic than men. My colleagues, Mary Claire Roche and Amani Jamal, will speak to this, as Karen mentioned, at the session in 2 weeks. And my colleague, Asil Al-Alaili, has actually written about it extensively on our Arab Pulse blog. But I'll mention very briefly here that we do see these double-digit differences between men and women in terms of concern. Those trends fluctuate a little bit over time. So you'll see in Algeria, that gap closes primarily because concern among women goes down. In Jordan, that double-digit gap stays, and it stays over time. And it fluctuates in Tunisia, but again, Tunisia, opposite Algeria, it's actually being brought down primarily by lessening concern among men. When asked to explain their concern, the majority or plurality of citizens in most countries, except for Libya, say that the fear is related to losing a family member or having them fall ill with the coronavirus. And so while the economy and the healthcare system and the education system all create challenges, it is still fundamentally the human toll of COVID-19 that is preoccupying citizens. And that's really at the heart of this continuing crisis. The rollout of the vaccine, however, doesn't necessarily or has not uniformly been seen as a potential solution. In 3 of our countries, Morocco, Libya, and Lebanon, strong and healthy kind of majorities suggest that they would likely get the vaccine if it were to become available. In the other 4 countries, however, there is less enthusiasm. Some of this age and education explains some of the variation that we're seeing. So for example, in Morocco and Iraq, the younger cohort, the 18 to 29-year-olds, are saying that they're more likely to get the vaccine than their older counterparts. Whereas in Lebanon and Tunisia, it's quite the opposite. But in Lebanon, Jordan, and Tunisia, it is the more those who have above a secondary education, so some amount of college, that are saying they're more likely. But one dimension of variation that splits these countries kind of into the vaccine hesitant versus not is the degree of trust in government. So in Algeria, Jordan, Iraq, and Tunisia, what we're seeing is that those who say they trust the government are much more likely to say that they will actually be willing to get the vaccine should it become available. And of course, governments won't develop trust overnight. So between this and kind of some of the demographic findings, these are suggesting that there are target groups for whom campaigns would need to be tailored in order for the vaccine rollouts to be the most effective. I started by saying kind of we've got these three trends, and in Lebanon and Tunisia, there is constantly high concern and also willingness to get the vaccine, but we're also seeing this decreasing concern and increasing concern in Jordan. So in Jordan, not only did infection rates skyrocket, but evaluations of many other COVID-affected areas are actually decreasing at the same time. So you'll see here, for example, that the ratings of the healthcare system, while still a majority, take a good fall, 19 percentage points between September and March, April 2021. In terms of education, that has those who are satisfied has also plummeted 28 points over time. And while there are slight falls in evaluations of the economy and the government, that has actually always been low throughout the duration of this pandemic. In Algeria and Tunisia, we're seeing is a potential realignment of what is causing most concern. So as numbers kind of go down, what's coming back onto the on people's radar screens is the economy. So you see in Algeria the 2 completely kind of cross in the middle, and at that right about when cases were about to peak. In Tunisia, the concern for the economy was originally highest. It meets kind of again when caseloads were starting to rise, but again is the forefront of how people are kind of thinking about the pandemic as late as March, April 2021. In Morocco, kind of two factors seem to explain why we've got 86% there saying they're satisfied with the government response to the outbreak. The first is relief aid. So unlike all other countries, 49% of Moroccans suggest that they have received some sort of aid. Among those 49%, 41% say it's monetary, direct, like cash payments. The other kind of piece that I haven't shown here is actually the vaccination campaign, whereby as of today, I think it's about 9.4 million Moroccans who have had at least one dose of the vaccine. So Morocco is significantly ahead of regional partners in that respect. Finally, in Lebanon and Libya, where concern has been consistently high, the healthcare system is constantly rated as lowest. Only 17% in Lebanon, 28% in Libya are satisfied with it. Of course, the healthcare systems in these countries have been really decimated by the economic and political crises that have befallen them. We've seen shortage of supplies, facilities that are in disarray or damaged, and the flight of a lot of foreign-born healthcare workers that were providing the main staff here. And so while evaluations of the healthcare system explain the highest concern in Lebanon and Libya, it's also really co-varying with this in relation to government citizens' ratings of the COVID-19 response. The lines move in tandem basically everywhere except you'll see Libya, which is a little notable there. They're actually responding to two separate governments, of course, the Government of National Unity that was newly formed earlier this year, which seems to be enjoying a little bit of a honeymoon period. And my colleague Mohammed Abu Falagha tells me that, that COVID has become part of the national conversation there. So at least somebody is talking about it. Another piece of the COVID-19 equation in MENA has been the ability of the healthcare system to handle either continued in-person instruction or to adapt and move to remote learning. So unanimously across the board, people are in agreement that the pandemic has negatively affected children's education, with upwards of 3/4 of citizens in these surveyed countries agreeing to that. Evaluations have fallen, but perhaps not as dramatically as they had in terms of the healthcare system, with the exception of Jordan, of course. According to UNESCO school closures reports, Jordan is actually the 20th country in the world in terms of the greatest number of days of closure, 148. But regionally, it's actually only the 5th after Kuwait, Iraq, the United Arab Emirates, and Saudi Arabia. Algeria had opened fully at the time of our second survey in October, but then went to total closure this past February and stayed closed through April. So again, people are being able to see what the education is and perhaps are not as happy with it online and on TV in a lot of these cases. But commensurately with that, citizens want to see more money invested into their education systems, be it from their own government spending. So it's after healthcare, the second thing they ask for most across these countries, and or from foreign investment. That they, when asked where they want preferences for foreign aid, they say. That, in all countries but Libya and Iraq, plurality shares say that they want it given to developing education. The strong desire for education spending goes in tandem not only with the evaluations of the education system, but also with the fact that in 3 out of our 5 countries, citizens are reporting that the biggest challenge caused by the pandemic is to the disruption of education of their children. About 1/4 or more, additionally in Tunisia, Iraq, and Algeria also point to this main challenge. But as you've begun to see from that graph, that the biggest actually pandemic-induced challenge has been that citizens are pointing to increased cost of living. And that increased cost of living is being reported more, of course, by those who cannot cover their expenses than those who can. So we're here starting to see this exacerbated effect of the pandemic on those who are already economically kind of disenfranchised. So we're this widening schism between the have and the have-nots. That gap is is a 2-point difference, and it's as large as 12 points in Lebanon and 10 points in each Algeria and Jordan. Citizens themselves are also acutely aware of the fact that this pandemic has had outsized effects on different sectors of the population, such that the majority in most countries are saying that the impact of COVID-19 on our citizens is greater on those who are poor. We also asked in Iraq and in Jordan, where we asked about refugees, and in Algeria and Tunisia, where we asked about migrants, citizens there are also reporting that those groups have been disproportionately affected. One potentially influencing factor, of course, leading citizens to point out this increased cost of living as the biggest challenge is COVID's effect on jobs. Among those who said that they had a job before the pandemic, it's small shares that have suggested that they've permanently lost jobs, although we are seeing a schism there in terms of older versus younger. But healthy, large shares are actually saying that COVID caused temporary job interruption. While again, not as great numbers suggest that they had to work from home, there we again are seeing a big gender gap that's as wide as 17 points in Lebanon and 11 points in Libya, with women being considerably more likely to say that they have had to work from home than men. And of course, that comes with a bit of a flag as we're kind of watching participation among women globally and what this work from home is meaning for future kind of return to the labor force at the workplace. Commensurately with job loss or interruptions, again, are the hardships people are facing in terms of meeting their costs of living. So, of course, among those who say that they have permanently lost their jobs, those who say they cannot cover expenses are much more likely to be in that category than those who can. And we see a similar phenomenon among those who have suggested that they have experienced temporary job interruption. So again, it's making it harder for the people who are struggling most. A second factor, though, aside from jobs that's influencing or leading citizens to point to increased cost of living as the biggest challenge-induced or pandemic-induced challenge, is the evaluation of government in keeping prices down. So again, only in Morocco, where citizens did receive aid, do a slight majority suggest that the government has done a very good job. Commensurately and unsurprisingly, it's those who can cover the expenses who are saying that the inflation, the government has done a better job at keeping inflation at bay. Such that if healthcare was kind of one piece of the COVID puzzle as I started, this inflation piece is another. And again, over time, we've seen evaluations of government response to COVID and response to inflation co-varying. But in countries where that approval was just above or around 50%, like Algeria and Jordan, you know, that line for keeping prices down is quite low, and the line for that I showed initially on healthcare is what's kind of propping or appears to be propping that government response up. So moving forward, what the barometer data suggests is that even as infection levels go down and governments start to devise strategies to address it, in many cases, healthcare is still part and parcel of that response, that illness and mortality not only have an economic toll, but they have a human one as well that needs to be kept that needs not to be neglected. And furthermore, that successful responses are not necessarily going to be one size fits all. So from vaccine distribution to stemming the economic fallout, kind of specific attention needs to be given to those vulnerable populations, to migrants, refugees, and to those disproportionately affected, like women or those who are already struggling to meet their expenses. With that, I'll turn it back to you, Karen, and look forward to discussion this more in the question and answer.
Thank you, Salma. This is such important data, and really so great that it's iterative and that we are seeing, you know, sort of within the pandemic and the recovery, how people's perceptions of government responsiveness is changing. We're first really concerned about mortality, and now more so on cost of living. We had a question in the Q&A about sort of the specific impact in Lebanon. I think you did touch on that, and the data show it very clearly that people are very frustrated about, just feeling like they can't make ends meet, and that, more impact on job losses. And that obviously has a lot to do with the cash, right? So I mean, I think the barometer is truly a bellwether. It's showing us what the next crisis will be. I know Yasmina wants to share with us a brief presentation. She's got some slides as well. So Yasmina, we'll give the floor to you, and then we'll go to our audience for some more Q&A.
Thank you, Karen. Yeah, my slides are on the screen. So just the first slide, please. Next slide, please. So just to give you some context on where my perspective is coming from, we're working on a project at the Brookings Dalha Center where we track government's economic, health, and security responses to the pandemic. And we've been doing this for the last 12 months. 14 months. So I'll discuss the points from the survey that jumped up at me using this related research. So I'd like to start by saying that a major similarity across these cases is that many had a strong security response at first, and many pledged grants and aid, created health and economic committees to advise the governments, and also moved to appease economic burdens of citizens and small companies. But few actually delivered. So you mentioned the example of Morocco, where citizens were happier with this. It's because the Moroccan government delivered on the promises. But in most cases, there were issues with the relief packages, and different countries were impacted by the subsequent waves to varying extents. And then, while some were successful with vaccination campaigns, others were not. So all of this broadly corroborates the public opinion results on government response performance. But overall, I think the key takeaway is that the initial best performers of the MENA region, like Tunisia and Jordan, benefited early on from the strong measures, but then struggled to control the outbreak during the second waves because they eased restrictions in favor of recovering their economies. So just the next slide, please. If we look at this, we see that Jordan, Tunisia, Algeria, and Morocco had strong stringency in the beginning. They announced curfew and confinement. They mandated social distancing measures. They imposed the use of masks and used their strong coercive apparatus to implement these measures. Next slide, please. And Jordan and Tunisia were arguably the best performers during the first phase of COVID and compared favorably with leaders like Australia and South Korea. Next slide. And at this point, Jordan consistently reported under 10 infections per million people per day, while Tunisia reported 20 new daily cases per million per day. And then when they opened the borders, when they eased restrictions, they struggled with the second phase. So I think that the drop in approval ratings for these two countries from July to October makes sense. Next slide, please. And another very interesting country, which Salma pointed out, is Morocco, where public opinion was impacted by the extremely successful and organized vaccination campaign. And actually, the strength here is that discussions to secure doses started as early as August 2020. And the campaign began in the end of January and has been going smoothly. Morocco's vaccination rates actually surpassed most of its neighbors in North Africa. And so this timeline would explain the improvement in public opinion from October to April. Next slide, please. Now, Algeria falls in the middle. It struggled a little bit in the beginning, and that's when the government was still, trying to contain the Hirak protests, which then were on pause for 1 year. But after the second wave hit, it actually kept its numbers in terms of deaths and contaminations lower than all of its North African neighbors. But its fatality rate was highest than all of them between March and November 2020. And this could point to an issue in screening and treatment effectiveness. And we'll come back to that later when we discuss healthcare. But also Algeria hasn't been successful in securing doses to vaccinate a major part of its population. Next slide, please. Now, in terms of economic impact, it's very interesting because in many of these countries, I said before, there was this announcement of relief packages in the beginning, and it was very well received by the population. But as the weeks and then the months went by, there were issues. Many people weren't receiving the aid. There was no transparency on how major funds like for example, the Moroccan fund, how that was being used, or how the money that Algeria was leaving for healthcare was being used. So there was little transparency overall. But there was a similar pattern if you think about it. So the goal was to support economically vulnerable citizens and businesses using aid, repayment plans, loan packages, and so forth, and then at the same time to increase spending and ensure liquidity provision. But the fiscal limitations across the board meant that the relief packages were smaller. And in countries like Algeria, which has hydrocarbons, this was felt, or at least criticized more by the population. So many citizens were reporting to governments overpromising and then underdelivering, which led to more criticism. And so if we look at the survey results, as it says, the public finds this to be lacking. And in middle economies, like Tunisia and Morocco, which don't have major hydrocarbon resources, this was felt harshly because unemployment rose and tourism dropped. And in these countries specifically, as in Jordan and others, this was a struggle before even COVID hit. So we should keep an eye out on the situation in terms of unemployment and underemployment, because it could be a major driver of contestation. Next slide, please. And the last point I'd like to discuss is the issues of healthcare, which Salma pointed at the end. So the trends we're seeing in terms of MENA publics remaining preoccupied with the virus spreading, they do make sense if we consider the epidemiological situation throughout the various waves. So Jordan has had the highest increase in cases and has the highest daily cases now. So the rise in fears between October and April is not surprising. The sharp drop in Morocco during this timeline could be linked to successful vaccination since January. And in Algeria, it may be due to the lower number of daily cases. In fact, Algeria has been reporting under 100 cases per day consistently over the last months. However, there is a fear that it may be underreporting because data in Algeria has been less available compared to other MENA countries, but this is not verifiable. I'd say the most surprising result for me was Tunisia, where the fear of COVID spreading has decreased by 20 percentage points, despite the epidemiological situation getting much worse since the first wave. And the final slide, please. So looking at all this, if I were trying to underline or highlight an outlook, I'd say that looking closely at government and response and public approval over the last year, and talking to people on the ground, I would say that one of the biggest concerns is upgrading the public healthcare sector, because this pandemic has highlighted many gaps. Even with the countries that boast the strongest health systems like Tunisia, over the last 12 months, there were issues. So these systems are currently stretched beyond capacity, and the recent and sad example of lack of oxygen leading to deaths in Jordan comes to mind. But beyond that, in almost every country we're looking at, there have been reports of limited intensive care units, limited equipment, regional disparities in terms of access to healthcare, be it coastal versus interior like in Tunisia, or rural versus urban like in Morocco and Algeria. And there has been a shortage of medical professionals, mainly because of that can be linked to emigration and brain drain. So for countries like Algeria and Tunisia, Tunisia to a lesser extent now, there's this added urgency right now in terms of vaccine needs, because they have not been able to secure as many stocks as other countries. And I think that healthcare may be another major driver of contestation that we should look at. So I'm going to end here, and I look forward to your questions in the discussion.
Great, thank you, Yasmina. We do have questions in the Q&A function if you're using Zoom. If you're looking on via live stream, you can email a question to events@mei.edu. I'm seeing a couple here really kind of on questions of variation among the cases and why you have the cases you do. So it might be helpful, Salma, if you want to just give a little bit of background on the barometer and where you do your survey work, and how that influences the results that you find.
Sure, thanks very much. Yeah, I see this question on why only 6 countries have been included. Of course, we try as much as possible every wave to include as many countries as possible. Our last wave included 13 countries. That was wave 5. But financial constraints, in addition to kind of making sure that we have free and fair access to countries, is what primarily drives which countries are included. Of course, again, we always want to have as many as possible. So, but those kind of operational constraints were the main reasons why we included 7 countries in this wave. And then I see, how do political hardships in countries like Libya, sorry, I just lost that question. There was a question.
Yeah, it was really a question about the variation, across the region in cases that have undergone, such a horrible year in terms of financial crisis or also political crisis. I think we saw in the Lebanon results through October to March how sort of changing perceptions of cost of living were really influenced by conditions on the ground there. Yeah. So I think that's what that question was about.
Sure, absolutely. So, I mean, of course, a lot of this has to do with where countries started when COVID hit and kind of where they got to over time. So, for example, Lebanon, of course, had its financial crisis where its debt to GDP ratio made it the 3rd most indebted country in the world. In March of this year, inflation rates hit 157, 158%, up from 17.5% in March of 2020. So as the economic kind of backdrop to this worsens, of course, and as Shahada mentioned at the beginning, mentioned at the beginning that has trickle down effects. So there are not enough hospital beds. There are not enough supplies. There's no oxygen. There's internal brain drain where kind of the nationals who are health professionals kind of leave, but also some of these countries actually had foreigners who were kind of the foundation of their healthcare system, like in Libya. And so when the pandemic started, a lot of them go back home because of lockdowns. They don't want to get locked down where they are. So kind of that a priori starting point really affected it. And of course, when the government response started, they, as we saw in that first graph, and they had it under control. And I think Yasmina pointed to this as well, that, people were prepared for the first wave, but then opened up too quickly, and we started seeing these massive spikes, such that next to actually Arab Barometer data suggests that next to people being afraid of their family members dying, the second most cited reason is that they don't that other citizens aren't following government recommendations. So they're seeing kind of these transgressions.
Yeah, I mean, there's a question now coming in as well in terms of public perception on, kind of the variants of vaccines, right? And, where they're coming from, how trustworthy are they? And in Yasmina's presentation, what also struck me, how reliable is reporting on case numbers, right? We've had, a lot of variation through the last 18 months as we've been, seeing reporting from all over the world. And I think it's fair to say now that we've definitely had underreporting just about everywhere, in some places worse than others. So in terms of our ability to know, how reliable is the information we're getting in terms of the severity of infection rates, and then what kind of information are people getting in terms of the vaccine availability to them from their governments, and how much choice to have, and how do they feel about the limited vaccines that are available, the kind of brands that they're getting. I don't know if either of you, Salma or Yasmina, want to comment on that.
I can comment. At least on the ground and speaking to people, there were more fears domestically of data being underreported in the beginning, before the second wave. And there were things I heard from people I was talking to, like deaths were being mislabeled as not being COVID or being COVID when they weren't, things like that. I think this was strongest for Algeria, and even externally. Algeria, for example, up to now hasn't updated its vaccination data. So what we're talking about now dates back from March, for example. But I think it's very interesting, the question about vaccination, because there's an exogenous impact because of vaccine diplomacy right now. So you're having Russia, China, and the EU competing for influence in the region by providing vaccination, either for sale or for donation. And then there was this period where you had the Russians speaking poorly about European vaccines and vice versa. And so I think that impacted domestic perception for the time being. In countries like Morocco and Algeria and Tunisia, you can't pick your vaccine. And so, for example, Morocco, which has the strongest vaccination campaign right now, AstraZeneca was the first dose to arrive, so that's the dose that was given. There was no choice. But it didn't seem to impact public opinion. People seem to be very relieved that they got the vaccine. And in places like Morocco, there were less conspiracy. Well, there were less fears that the vaccine would have secondary effects, conspiracy theories, than places like Jordan, where despite there being stocks available, people refused to go for the first month or so. I think that from what I'm seeing, the external press and media had more of an impact than the governments themselves.
If I might jump in there and add, so we actually asked specifically this, and Aboud Kayali will speak to it next week a little bit more. We asked how much trust citizens had in the statistics being reported by the government on COVID infection rates, and we're seeing something similar to what Yasmina is suggesting, where that varies quite a bit and it's not very high. But that is part and parcel of kind of greater trust issues with government institutions. So that's a trickle-down effect almost.
Well, we'll look forward to that, presentation of those findings next week when we have our third session. Just looking, if there are any more questions coming in, please put them in the Q&A or send via email to events@mei.edu. Salma, I wish, maybe you could tell us what are the plans when you do the next wave of surveys. I mean, how do you intend or plan to track these perceptions of the pandemic and the government response? I mean, there is going to be, I think most of us who are following the region in economic terms, we're getting into sort of a commodity super cycle. We're expecting more price inflation. We're expecting food prices in particular to be going up. What do you anticipate in terms of your survey design to follow these effects?
Thanks so much. So that's actually exactly what we are in the process of doing right now is finalizing our questionnaire for our 7th wave of surveys, which we hope will be in many more countries and face-to-face starting in September, October of 2021. But this is exactly what we're building into it. So not only following some of the trends that we have started to see in terms of whether concern starts to dip or rises again based on what happens with the infection rates, to see if there are changes in citizens' perceptions on what the government should be focusing on. But a big part of this survey is exactly this: the ecologies of advantage and disadvantage, what people perceive as kind of these cleavages and where those either demographics or economics, kind of the intersectionality of those identities come together to produce different experiences, with respect to addressing the challenges of the pandemic, but also kind of writ large in regardless almost of the pandemic, because some of these challenges are going to kind of continue long after the pandemic has ended. Additionally, there are kind of deep dives, for example, on these issues of kind of the vaccine diplomacy, on issues of trust in various kind of parties, and on disaffected groups. So we are looking particularly at women and kind of trying to see what are the barriers that they are going to face to entry or re-entry into the workforce after the pandemic is over, and how kind of the pandemic has affected ideas of kind of rights and roles, which was always something that the barometer has looked at in our previous wave. So you know, as the home kind of became the epicenter of life during the pandemic, if responsibilities or views of who was traditionally responsible has changed over time. So those are kind of the key issues that we are preparing for in our seventh iteration of this.
Yeah, and I think that's going to be really interesting to watch, particularly on women's employment and sense of the ability to rebound, right? And that's not just to the Middle East; that's everywhere. It's going to be a global phenomenon. Yasmina, did you want to add anything to those questions or any other comments?
No, I think we covered things well, but I'd just like to say, if anyone's interested, the project is up live on bookings, the COVID project, and please feel free to visit.
That's great. Do you want to, maybe you could put the link in the Q&A so we can share it? That would be great. Yeah, I mean, I think one of the things we want to do at MEI in our economics and energy program is also provide resources to the studies and the research that's going on about the region, about COVID, but about all kinds of other economic indicators. And so it's really important to me that we become a go-to place where we point people in the right direction of good work that's happening. So I commend you both to the Arab Barometer project, keeping going. I mean, the fact that you completed survey work in the past year is really amazing, and I commend you all for keeping the project going and keeping this service really alive, and to Yasmina, to your colleagues at Brookings Doha for starting a new investigation, right? And under a really difficult period for social scientists as well to be conducting research and gathering data. So well done from both of you. And there, Yasmina has put the link, and I will share that as well in our Q&A. Well, I don't see any other questions. Anybody out there, if you'd like to post sort of your last chance in the Q&A function, we'd love to hear from you. And we will have another opportunity with the presentations from the barometer, 2 more sessions on these survey results from wave 6. Oh, I think I see one has just come up. Sorry, give me a moment. Oh, we have a question. Can you speak to the impact of COVID on prisoners? And we haven't really talked about, those kind of vulnerable populations. That's quite a specific question. And then another question, do you share the results with governments, right? What kind of policy impact is the Arab Barometer project having, and what kind of back and forth do you have with regional governments? That's a good question.
Sure. So with respect to the first one, so our surveys are nationally representative, but they exclude institutionalized populations, unfortunately, because that's an issue of access primarily. But with respect to kind of sharing our findings, yes, absolutely. With governments, so first of all of the data is publicly available. So many of the findings that I'll discuss today are going to be available. The graphs are, anytime anyone wants data from this, they can actually submit a request. They can use our data analysis tool online. So kind of, in kind of a commitment to making this data useful to as many audiences as possible, it's there for everyone to see and use, and it's there for everyone to ask us to help with analyzing should they need it. In terms of kind of making it available to governments, absolutely, they're part and parcel and a big part of that kind of audience. We do try and do as many dissemination events as possible to kind of let the data speak for kind of, these are the unfiltered voices of citizens. There are numerous implications that come out of that. So for example, with respect to our vaccine question, this survey, it really seems that the campaigns that are going to be successful in getting people vaccinated are going to have to overcome a trust barrier. And we've seen this actually around the world. So it's not just in our surveyed countries where kind of members of different communities who people trust, who are most familiar with, kind of need to be part of those efforts. So that is kind of one solid place where kind of there's a clear policy prescription or suggestion, at least, that could come out of using our data.
Yeah, I think that's exactly right. Yeah. All right. Any kind of closing comments from Yasmina, and then Salma will let you have the last word.
Yeah, if I just may, on the prisoners question, in the beginning, between March and July, there were many reports in several countries where there were outbreaks in the prisons, and then these the cases quickly multiplied. The most public of which actually was in Morocco, and at one point there was no longer any report or media report on this because presumably the regime shut this down. The way that it happened in the beginning was that there would be a report of an outbreak, people would die, and then the authorities would say, we have it under control. We'd have silence for a few weeks, and then it would start all over again. And every time we had another report, it was much more deaths and more contaminations. But after the summer, we stopped hearing about it. But it is unlikely that it was because the cases went down when in the rest of the country the cases were going up. It was most likely because it was the governments that stopped giving the information internationally.
Salma, any sort of closing comments on your survey work?
Yeah, sorry. So I would reiterate kind of along the same line of Yasmina saying is that they're kind of the Arab Barometer 6th wave really does suggest that as governments devise strategies, they cannot neglect kind of the health piece of this, that has to remain center stage, and that commensurately there is no one size fits all approach that's going to be successful to kind of mitigate the effects on different communities within countries. The Arab Barometer will be kind of keen to keep an eye out on that in our upcoming 7th wave surveys, where we look at these ecologies of the disadvantage and advantage. And we hope to be back to share our results with you at that point.
We will certainly welcome you. Thank you for the work that you do. Thank you for the work that you do, Yasmina, as well. And look forward to sort of building more of a community of researchers looking at the impacts of this pandemic. It's going to be with us for a long time, particularly in labor markets and in perceptions of government capacity. So my thanks to you, and also to Shela, who joined us and had to leave earlier. And to all of our viewers out there, thanks for joining us at MEI, and we'll see you soon at another webinar.